So once again, Assalamualaikum, a very good evening to everyone. My name is Azrul Muhammad Khalib from the Galen Center for Health and Social Policy, and I will be the moderator for this session. Our co-host for this evening is REFSA, the Research for Social Advancement think tank. And to kick off this evening, let's have a few words from the Executive Director, Ms. Tan Ihan. Please go ahead, ma'am.
Thank you, Azrul. Hi, everyone. Very good evening to the three speakers, to Azrul and to everyone, including those watching on Facebook Live, for joining what I would say a particularly timely discussion on a topic that impacts each and every one of us. I am Ihan from REFSA. I will keep this short so we can go straight to the discussions and questions. I think it has been a year since Malaysia started battling the COVID pandemic with a very tight MCO lockdown. I'm sure everyone remembers, in mid-March 2020. And since then, we've been in and out on the various degrees of the travel restrictions, opening and closing of the economy, etc. So back then, I think the hope and aim for these measures has always been to dampen the transmission rate and the pandemic curve, while scientists work on successful vaccines to increase people's immunity and stop the transmission. So a year later, here we are. The first vaccines has finally arrived in Malaysia, and in the coming days and weeks, hopefully we are ready to administer our vaccination program and roll it out progressively within a schedule to the rest of the population. The main challenge now, I think, is apart from getting the vaccines to all corners of our country, is that when the vaccines are presented, whether people are ready or willing to take it, and whether they are equipped with the right knowledge and facts to understand what the vaccine does and how it can impact positively to protecting them and their families, curbing the spread in the community and the overall driving down transmission rates, etc., etc. I think the bigger danger here is therefore a broader vaccine hesitancy. In fact, WHO lists vaccine hesitancy as one of its top 10 global health threats. So in Malaysia, in mid-January, Ministry of Health surveys indicated that 1/3, I think if I'm not mistaken, about 33% of respondents remain either hesitant or opposed to the idea of vaccinating against the COVID-19. Individually, we may have come across friends or family voicing concerns over the safety of the vaccine available, the efficacy of the vaccine, or subscribe to perhaps even conspiracy theories about immunizations. So this, to a large extent, is also due to a significant mistrust that still weighs on conversations around vaccines. We must be aware that decisions made based on inaccurate information will not just impact our lives and those around us, but also have consequences in the ability of our society fighting this pandemic. There is hence an urgent need to build trust and credible information by addressing these concerns and allow us all to make informed decisions. So with this in mind, spearheaded by the Galen Center for Health and Social Policy, together we want to organize this discussion platform as an opportunity to hear from practitioners who will share their medical knowledge to fight against misinformation and for queries to be raised and addressed. We hope that today's discussion, after today's discussion, we can all arm ourselves a little bit better with knowledge and facts based on science that will inform our decision on vaccinating ourselves and our family. Tonight, we have here with us three very distinguished speakers, Dato Dr. Musa Muhammad Nordin, Dr. Helmy Haja Mydin, and YB Dr. Kelvin. Welcome to all three of you, and thank you for joining us tonight. Moderating today, as mentioned earlier, is Azrul, Chief Executive from the Galen Center for Health and Social Policy. So without further ado, I will pass the floor back to Azrul. Thank you again. Enjoy the session, ask lots of questions. Let's equip ourselves with good knowledge of how this works, and have a good evening. Azrul, over to you.
Thank you, Ihan. Just as a reminder to everyone that they've got the right session, just wanting to put up this slide here, but also if you have any questions that you would like to ask, please do ask them on Slido, and this is the address that you can go to ask your questions. If possible, don't ask them on the chat because there's so many chats going on the side and we might miss them. But if you want to ask your questions, please use the Slido link and go and post your questions on the Slido app. So if everybody's got that, let's go ahead and start the session. So thank you again, Ms. Tan. To discuss the issue of COVID-19 vaccines this evening, we have a great panel for you all who have managed to attend. It's a full house. Never thought it would be possible to get a full house for one of these, but it is tonight. We have Dato Dr. Musa Mohd Nordin, consultant pediatrician and neonatologist at KPJ Damansara Specialist Hospital. Dr. Helmy Haja Mydin, consultant respiratory physician and head of the Lung Center, Pantai Hospital, Kuala Lumpur. And Dr. Kelvin Yee, chair of the Parliamentary Select Committee on Health, Science and Technology, and that's his part-time job. And his full-time job is as Member of Parliament for Bandar Kuching. Welcome, gentlemen.
Thank you.
Thank you for having me.
So unfortunately, as you can all tell, they're old men, for which I apologize. We will be more inclusive in the future and try to avoid such manners. So the format for this evening is going to be a town hall format where the speakers will take questions for the audience and myself. And we are first going through doubts, myths, and later end with the facts regarding COVID-19 vaccines. This forum is going out live on REFSA and Galen Center's Facebook pages. So if you want to see, or your friends can't get into this Zoom platform, please ask them to go to those Facebook pages instead. So the recording will also be made available later. So without further ado, let's start with you, Dato Dr. Musa Nordin. You have been an outspoken health advocate who has pushed for improvements to be made in the COVID-19 response, from analysis of epidemiology models and screening strategies to now vaccine safety concerns being raised by healthcare professionals themselves. You recently responded to this video by Dr. Roland Victor, which went everywhere. We're getting many reports, mostly anecdotal, about healthcare professionals who are vaccine hesitant or expressing doubt regarding these vaccines. How are we going to address these concerns, seeing how it's important for healthcare providers themselves to be convinced so that they can then promote vaccines? Go ahead.
Thanks, Azro. Hey, hi guys. Good evening. Yeah, this is a major concern. When we did a webinar about a few weeks ago, there were about 500 healthcare workers, professionals, and Dr. Allen did the Slido, and there were 75% who opted for the vaccine, i.e. a quarter were against. And after the session, we managed to lift it to 92%. So that's reassuring, because when we provide the evidence, yeah, they come on board. And it's extremely important that we get them on board, because doctors, like teachers, are a trusted group of people, unlike politicians. I'm sorry, Kelvin. I didn't know you were.
It's one of us, yes.
Okay, anyway. So you see, our patients trust their lives with us. So when we say, take the vaccine, they will take the vaccine. If we say, I don't believe in this vaccine, you know, it's a gene therapy, it doesn't prevent disease. Yes, they will refuse the vaccine. And studies have shown that those who initially refuse a vaccine, right, or refuse a therapy, after counseling by the doctors, virtually all of them came on board. So I think it's extremely important for us to work with our healthcare professionals to get them on board. I think we are not unique. In the United States of America, 1 in 3 are refusing the vaccine, right? We are a quarter. We managed to win them over, and I believe with guys like Kelvin and Helmy, inshallah, they'll come over with time. But we need to do it real fast.
Can we afford the time? I mean, right now, if there are reports that healthcare professionals in even public hospitals, a certain percentage are refusing to possibly get vaccinated. What's the best strategy? Countless CME webinars? I mean, one-to-one approaches? How do we go about convincing many of these doctors concerning the effectiveness of these vaccines?
Well, I think it's multilateral approaches. Yeah, the Ministry of Health has to be doing its stuff. Yeah, and then not only that, when they do get on board, those who are, it's fine if they don't want to take the vaccine, but when they go online, right, and share fake news, misinformation, I think they need to be hauled up by the Malaysian Medical Council. Yeah. Not being punitive, but show us the evidence. If they fail, then I think we need to take disciplinary action against them. So we have to be very, very stern and firm, because this is a national agenda. And you guys, doctors, are supposed to be the purveyors of truth, of evidence-based medicine. So if you make it as a personal choice, I'm fine with that. But when you begin to be agent provocateurs, then we will have no mercy on you.
Well, sounds pretty strict and firm there, Dr. Musa. But let me ask Dr. Helmy now. You have a situation right now and you have a patient coming over to you, and this is in the form of a question. Somebody has asked. There's a story out there that Pfizer and Moderna mRNA vaccines are not true vaccines, but gene therapies. How do you answer that? Go ahead.
I think the concept of the vaccine is to prepare your body to engage with the virus when it actually comes on board, is to prepare the immune system, your army in your body, so that you do not actually suffer the full consequences of the disease. And there are many different ways in which vaccines work. So how, say, the polio vaccine works is different from the influenza vaccine, is different from the COVID vaccine. The technology behind it may be different. And there's this misconception that the technology behind mRNA vaccines are new. The technology has been there for a long time. It's just that this was used for the first time with this particular vaccine. And the vaccine, the mRNA vaccine, whether it's by Pfizer or Moderna, they don't actually alter your genetic material. And mRNA is different from a DNA. And what happens is they produce proteins that then allow your cells to produce the right sort of reaction, so that when the virus comes along, once again, you've got this army that's prepared to fight it off. So no, it does not alter your genes. It will not stay in your system for more than a few seconds, actually. And at the end of the day, it's not going to cause you to turn into zombies or something like that.
So let's be clear, Dr. Helmy, this is not gene therapy.
It is not gene therapy.
Yes, go ahead, Dr. Musa.
The mRNA stays in the cytoplasm. It does not enter the nucleus. Therefore, it cannot make any alterations to your DNA. Full stop.
Right. Okay, that's good. That's very firm and it's very clear. Anybody who skipped their biology classes back in secondary school probably have to brush up a little bit about what cytoplasm is, but let's go over.
I quickly add as well, it goes back to the earlier points. There's a lot of scaremongering. And even for myself, I had to read up about mRNA, once this whole thing came about, so that I actually know our stuff. And as Dr. Musa say, is really reinforcing those basic sciences and the basic message to folks.
I mean, that's good to know that basically this is grounded in science. It's grounded in evidence, and most importantly, it's proven technologies that have been able to be seen to work through the clinical trials that have been carried out. But Kelvin, you're the politician here, but you're also a doctor. And you've mentioned that some of your brethren, MPs, quite a number of them are themselves vaccine hesitant or having second thoughts about whether or not they want to put themselves forward to be vaccinated. How are you dealing with it amongst your colleagues?
I think we need to separate the anti-vaxxers group and those that are hesitant due to maybe lack of information. Actually, they are, general members of the public. I recently had a conversation with Punara Hospital, and the person mentioned that expecting to see about 10 to 15% from their medical staff hesitant to take this the vaccine itself. So among the elected representatives, a lot of them are also sharing information which are not entirely correct. So one of the initiatives that we had to take was to inform them. I think we all are information frontliners per se. We are all part of WhatsApp groups that may have way too many members, annoying family members, annoying neighbors, and stuff like that. But then every time we see such a message or such half-truths or even completely lies being forwarded, it is important we educate them. And I think as an MP or even as an elected representative, we have a duty or responsibility to disseminate right information to the people based on science and data. So again, as I said, there are groups that are clearly anti-vaxxers. That means they are totally hesitant. They're trying to spread propaganda, misinformation to cast doubts on the safety and effectiveness of the vaccine, or even to disrupt the whole the vaccine plan itself. But there's a whole other group which we need to reach out, which is basically members of the public who genuinely needs information, education on the vaccine itself. And all of these concerns are actually understandable.
But Kelvin, I have to ask you, do you think it makes a difference to see your wakil rakyat, your young berhormat, to be vaccinated before everybody else does? Does that menaikkan semangat or give them confidence to then get vaccinated? Would it make a difference?
I think it will make a difference, not just the wakil rakyat, but even famous personalities, celebrities. I think they do have certain following. So for us to take the vaccine or even push messages of confidence on this vaccine, it is very important to get that following and for them to buy into the whole vaccine program itself.
Okay, that's great because I think tomorrow, right, we're going to see the Prime Minister and the Director General of Health get themselves vaccinated, and they're going to be the first ones to be receiving that jab, and we're going to see what kind of response comes out. Hopefully people will be emboldened and encouraged to come forward. So let me ask Dr. Musa, we have a question from a member of the public here who's asking, what is it? Are there any risks for a breastfeeding mother to be vaccinated? I mean, if we're talking about the vaccines that are available today, it's going to be the mRNA vaccine. So is it okay for them to be vaccinated?
Thanks, Azrul. It's an excellent question. And of course, it's one of the concerns of not just a breastfeeding mother, but also a pregnant mother. Yeah. There are no trials being done in pregnant women, lactating women, and in children under 16 years old, all right? But there have been women who got pregnant during the trials, and they are following up these women, and so far it has been reassuring. There are also trials that Moderna has done on pregnant rats, and there has been no abnormalities in the fetuses or in the babies that were born from these baby rats, okay? And as we have said just now, the mRNA does not enter the nucleus, so it would not harm the DNA, right? And therefore, there'll be no risk of congenital abnormalities or teratogenicity, okay? And the mRNA is very fragile. It degrades very quickly, right, into nucleotides. So the CDC, the American College of Obstetricians and Gynecology, the American College of Fetal Medicine, all right, has said that it is okay for the gravid mother, pregnant mother, to be immunized, plus the lactating mother, right? So I think that is very reassuring. But the WHO and Malaysia is very cautious. They say if the benefits exceeds the harm, then it is okay to take the vaccine.
So, you know, there's been some studies coming out from the US and through the Pfizer's own reporting, where they have found women who have been pregnant and given birth, and that they found that in the newborn, had antibodies against COVID-19, which is a direct correlation to the fact that the mother had been vaccinated sometime in that process of I think participating in a clinical trial that was held by Pfizer. Isn't this something that's a positive effect as a result of being vaccinated while being pregnant?
Yeah, it's amazing. So that means there is transplacental transfer from mother to baby, so conferring protection to the baby. This is just like the influenza vaccine, like the pertussis vaccine, like the tetanus vaccine, right? And since the newborn baby is vulnerable, so with the transplacental passage, it would protect the baby. Yep, great news.
Oh, yeah, that's really good. You know, it's quite positive to know that, and certainly if there's some protective property that those antibodies are able to confer upon the newborn, that'd be great too. Dr. Helmy, you're a specialist in the respiratory system. We have questions here from people who are asthmatic, who have some form of comorbidities that are relating back to, you know, TB, as mentioned, just not asthmatic themselves. You know, what kind of reassurance can you give? Can they be vaccinated? Can they receive the vaccine?
Not only can they receive the vaccine, they are definitely a group of individuals who should be getting the vaccine. But the other reassuring thing is that for individuals with asthma, for example, if your asthma is well controlled, then your risk of complications from COVID-19 is similar to any other individual. So sometimes I do get patients who, they come to my clinic and they're worried at the fact that they have TB or the fact that they have, say, COPD, for example. They are a little bit more anxious about the whole situation we're facing. But when the respiratory system is well controlled, the risk is minimal. And in fact, we find that the complication rate is higher when it comes to those who are elderly, those with diabetes, heart failure, and kidney failure.
And question to Kelvin, we have concerns that have been raised that perhaps the vaccines strategy may be something that is right now prioritizing the wrong people, that perhaps rather than be looking at, politicians, police officers, and some of the people that have been identified as phase 1, that they should be looking more at the people living with comorbidities, older people, people with chronic kidney disease, diabetes, and so forth, that because they are more at risk, perhaps we should be prioritizing them instead for phase 1. What do you say to that?
I think when we deal with the scarcity of vaccine, or when there is a limited supply of vaccine, especially even when we ordered from Pfizer, it's coming in different batches. I think we have received, 500,000, and then eventually we receive up to 1 million. So if we want to, of course, ideally, we should include all these people, all the need groups, whether it's those with comorbidities, underlying NCDs, even elderly in nursing homes, teachers, and stuff like that. Ideally, we include all, but when you're doing scarcities, you have to make the tough decision who should get it. That is why, if we base it on the recommendations like WHO, one of the recommendations is for the frontliners, because they are constantly being exposed to source of infection. And then if the frontliners get it, then we kind of handicap the whole healthcare system if there is an outbreak in any of the healthcare facilities. So I believe that is why the government made that decision. I personally am of an opinion that the elderly, especially in the nursing home, should be given priority in phase 1. Actually, there's not so many of them, so I believe there is enough to vaccinate them. Because if we look at the case of the UK, I read somewhere that I think during the starting period of the whole pandemic, almost 6% of those who are staying in nursing homes were perished and died because of disease, and this is very, very significant. And then in order, if we want to focus on long-term care, to reduce the burden in the healthcare centers, and of course to reduce mortality, you need to start with the high-risk groups. So again, there are different schools.
Okay.
There are different school of thoughts. There are different ways to think about it. But when we're dealing with scarcity, I think decision has to be made who needs what and which groups should get it first.
It's interesting that you say this, because when we look towards Indonesia, their strategy is entirely different. They're looking at between the ages of 15 to 60 to be vaccinated first and everybody else later on, right? Because the idea is that they're more active, they're much more likely to be exposed and likely to be contracting and to then transfer that infection to their older loved ones. And that's something that they've adopted as a strategy. and
But-
also considering the type of vaccine that they have also, which matters, right?
That school of thought basically is when they say they want to restart the economy quickly. So when
Yeah.
they want to restart the economy quickly, so they start with the most active group of people. But the issue is that in the case of Malaysia, for example, if you look at that group, it's millions. So at the current stock of vaccines that we are getting in phase 1, we cannot cover that whole.
Okay.
So that is why I believe that decision was made.
There's an important question here, and since you get briefings from the Ministry of Health, maybe you can help answer this question. This person asks, my father only trusts Pfizer and AstraZeneca, probably doesn't trust the Chinese and the Russian vaccines. Can he refuse the others and still benefit from the public vaccination? Does he have to go to private hospitals? Basically, the question here is, does he have a choice?
I think based on the current national immunization plan, the public is not given a choice for the vaccine that they've taken. And of course, the thinking behind is mainly logistical, mainly the mechanism of distribution. Because if everybody turns up in a vaccination center and say that I want this, so, it is very difficult to handle in terms of logistics and the whole process. Because each of the vaccine, including Pfizer especially, they have very special handling conditions. Imagine I'm taking out of an ultra freezer, putting it at the vaccination center, and then suddenly people start choosing different ones. How do you then make a decision? But when for a government, and I agree, for a government to make sure that all groups, especially the B40s or the M40 and those that could not afford a private sector, I believe that they should, trust the NPRA. I believe in the professionalism and the quality of the NPRA. If it is proven or if it has been approved by NPRA, I believe it is safe. However, the next step forward is I think the government should allow the private sector in and to obtain this vaccine as well. So one of the ways to reach the intended target of coverage for this vaccine is to involve the private sector. And this gives a choice to those that are willing to pay the M40, the T20, so that they don't need to queue up in a long queue and just add to the whole congestion in the common vaccination center.
Okay, I think that's fair to say that, and I think that's something for the future for us to look at, where there are going to be private options that are going to be available for COVID-19 vaccines.
Azrul, can I pitch in?
Dr. Musa, go ahead. Yeah.
Don't wait for the future, Azrul. Tomorrow, the NPRA needs to immediately license under EUA all the other vaccines, especially Moderna, AstraZeneca, and the Russian Sputnik 5. These are all, they've been published in the New England Journal of Medicine and the Lancet. Of course, we'll be more hesitant with the Chinese vaccines, yeah, and Novavax and Johnson & Johnson because they've not published, right? But I think the dossier is very clear. In fact, J&J is already submitting to the FDA and is due for review on the 24th of February. February, yeah. So, number one, NPRA needs to get its act in order. If the NPRA gives the green light, then I think the private hospital should be given the option to procure the vaccines. Yeah, as it is now, 30 to 40% of vaccination is done in the private practice. So we can relieve the burden from the government, so they can deal with those who either cannot afford the vaccine, yeah, or who chooses the vaccine that's provided by the government, right? So this is a smart option that the MOSTI and MOH needs to consider quickly.
So I think that recommendation has been floated quite a bit by the private sector, especially and certainly people who are wanting to have a choice in being able to select which vaccine that they want to be able to have. And you're right, it can be done tomorrow even.
Just the choice, Azrul, look, some of them are young businessmen. They want to travel, okay?
Sure.
Some of them have got kids going abroad to study. They want the vaccine and they are last in the hierarchy. Some of them, the T10, they don't want to queue in the Ministry of Health. The expatriates, you know. So that's
let me ask you, Dr. Musa, we've been talking a lot about NPRA. Over the past couple of months, we've been mentioning the acronym NPRA. It's got to be the most famous acronym when it comes to the COVID-19 and vaccines. What is NPRA? If you could just explain to us very briefly.
Well, it's the National Pharmaceutical Regulatory Agency. This is the body with some good people on board, from various disciplines, from infectious diseases, epidemiology, public health, pediatricians, internal medicine, people who sit, and I think there's 13 of them, and deliberate on the dossiers that's presented by the companies, and then they decide whether we can allow them to be used early for a limited period of time. In the States, it's called emergency use authorization. So hopefully, you don't need to reinvent the wheel. I know the guys sitting on the FDA, there's 17 of them, 5 of them are pediatricians, and all the 5 pediatricians are really smart guys, and they have not sold their souls to the big pharma. These are really, I know one of them. I was in CHOPS, Children's Hospital of Philadelphia. He founded a rotavirus vaccine. This guy is a gem.
Okay, Dr. Musa.
Technically, that's very important. So that's why these guys have done a lot of job. Have a look at it, and be humble enough that they are experts at the cutting edge of the science.
Let me ask Dr. Helmy. Dr. Helmy, are you there? I can't see your...
I'm there. I think my battery is dying, so it automatically shut off the video, I'm afraid.
Okay. Well, we have some questions here for you, and one of it is from someone who is asking, they have allergies to NSAIDs and aspirin, presenting swollen eyes, face, air passages. Can they take the vaccine?
Yes, they can. I think anybody who has a history of allergies, of course, there will be concern about reactions, because most of the headlines that you see coming from across the globe is about hypersensitivity, and in very, very rare cases, anaphylaxis. Now, if you have a known history of an adverse reaction to contents of the vaccine, then it's a contraindication. But even in the UK, for example, right now, anaphylaxis per se is not the contraindication. Now, what we would say is that anybody who gets the vaccine will, of course, be monitored for a certain period of time. So, for example, in the States, in the cases where there were anaphylaxis reactions to the Pfizer vaccine, most of it happened within 10 to 11 minutes or thereabouts. So you get someone the vaccine, you get them to be monitored for a period of half an hour at least, just to make sure that everything is okay. And this is, in a way, standard practice for anything that you'll be introducing to a patient when it comes to a medication that would affect one's immune system. So no, if you have an allergy or history of allergies to NSAIDs or aspirin, it is not the contraindication to getting the vaccine.
Azrul, can I give a perspective? This is very important. It's brought up all the time. The Pfizer vaccine, anaphylaxis is 4.6 per million. The Moderna vaccine is 2.5 per million. Now, let me tell you what is the allergy to peanuts. 30,000 per million. Do you stop eating? You stop makan your peanuts?
Nasi lemak, that's about
allergy to peanuts. Yeah, nasi lemak. There you are. The allergy to peanuts is 10,000 times more than the anaphylaxis to Moderna or Pfizer vaccines. I mean, this is what we call a risk-benefit analysis. And of course, the benefit is much more for the vaccine.
Just to add on to that, really, there was just a report that was released a couple of days ago by the US Centers for Disease Control and Prevention, CDC, and they looked at 6,994 adverse events after vaccination, which was reported between 14 December and 13 January, during which 13.7 million doses were administered, and 6,354 were classified as non-serious, 640 as serious, which included 113 deaths, of which these were not directly linked back to the vaccine itself. So we're looking at basically a very small percentage of adverse events, which the CDC has said is actually in the range for those reported for the influenza vaccine. So are we able to say that the kind of reactions that we're seeing right now are what you would expect for a vaccine that is aimed towards dealing with influenza? So you can do a comparison, I suppose. It's similar.
Azrul, to me and you, they don't look at the numbers. I give 80% say it's very painful, the first shot, And And of course, it disappears after 1 or 2 days. 5% say a bit of tenderness, a bit of redness, expected lah. And then the systemic side effects can be worrying. Headache, 60%, fatigue, 60%, and then myalgia, this body ache, another 30%. To some, it's very disturbing, but to a doctor, you know what he says? Man, this is really great. That means the vaccine is kicking in.
Yeah,
this is
working.
what we call the cytokines is being produced. So my body is making the antibodies. So a doctor who has a good hold of vaccinology will be really excited and say, my body is now really ramping up.
The most
Exactly.
The
the
coronavirus.
most common side effects that have been reported is headaches, fatigue, dizziness, chills and nausea. Some people have reported muscle aches, fever, joint pain, and pain at the injection site itself. So essentially, these are all pretty much within the range of what you would expect for a vaccine. Dr. Helmy, you wanted to say something. Go ahead.
No, I'm just saying I totally second what Dr. Musa is saying. You know, when I get the influenza vaccine and I don't have a reaction, I kind of wonder to myself, oh, did it work? You know,
Yeah.
so it's you expect your immune system to respond to it, and we've had a lot of conversations about the short-term effects, right? Then one of the most common comments I get is, oh, we don't know what the long-term complications are, and you know, of course, we don't know what the 5 to 10 to 15-year complications are, but I can tell you that the 1 to 2 year complications of COVID is devastating. You have seen just in 1 year how the entire global economy has come to a shutdown. You've seen how literally millions of people have died. And this is not counting the fact that people have got long COVID syndrome, people have had long-term respiratory issues. And in many, many cases, there are non-COVID diseases such as cancer, TB, heart disease that's being delayed in terms of diagnosis and treatment. So I find it, to be honest, quite annoying when someone tends to come up with this so-called clever statement of, oh, we don't know what the long-term effects are. I mean, how long are we supposed to wait, right? Do we wait 10 years and let all these people die before we do something about it? I think that's just a ridiculous question, to be honest.
Kelvin, you know, one of the things that you'll commonly hear today, especially amongst those who are hesitant in wanting to take the vaccine, is, can I not take the vaccine and hope for herd immunity to protect me from COVID?
We have seen from the case of Sweden that it doesn't work. We have seen for the case of the UK, it doesn't work. So at the end of the day, actually a lot of people ask me, can I just not take it now and just watch it and take it after? At the end of the day, we all need to take it. But how long are you going to wait for it? Do we want to see the effects of it? Like Dr. Helmy just now, and I want to echo his statement. Are we going to wait for 10 years of data? Only then we take some proactive steps to actually address it. So I think that's...
But today we're starting to talk about herd immunity, and we're looking at a percentage of the population that needs to be vaccinated. What percentage are we talking about in terms of achieving that?
I think
that goal of herd immunity?
They mentioned about 70 to 80% of the population has to be vaccinated. But then we also again need to understand that the current plan only involves adults 16 years and above. And there are groups that do not are contraindicated per se, especially those immunocompromised and for now pregnant ladies. Of course, I understand what Dr. Musa is mentioning, but there are groups that are contraindicated. So for us to achieve that 80%, while keeping in mind there are other groups that cannot get it, all of us that are healthy, strong as an ox, or generally needs has all the underlying issues, we need to get vaccinated.
So speaking about trying to get to 80% of the population to be vaccinated to get to herd immunity, Dr. Helmy, there's a question here from a viewer who's concerned about their parents, their older parents with pre-existing conditions like heart problems or high blood pressure. Is it okay for them to take the vaccine, and what kind of options are available for them? Will they even be prioritized in the existing rollout?
So my understanding is that in phase 2, these are the individuals who will be prioritized depending on age, depending on comorbidities. And once again, sometimes there's the fear that if somebody has got multiple diseases, then they may not react well to a vaccine. But the opposite is usually true. It is these individuals who do have these comorbidities that actually need the vaccine more than others. And earlier you mentioned about how maybe in Indonesia, they're focusing on the folks who are healthier in terms of economic contribution. But I would kind of go for the option of giving those with higher comorbidities, because we're not only protecting them, we're also indirectly reducing the cost to our economy, because these are the individuals that take up the most cost when it comes to hospitalizations, when it comes to use of critical care facilities. So we can reduce the impact and burden of disease. It helps not only from a humanitarian point of view, but from an economic point of view as well.
Can I just pitch in, Azrul?
Go ahead, Dr. Musa.
We're already seeing this happening in the real world experience, yeah? Israel has immunized about 80 to 85% of its population. And even before the second vaccine was given to the elderly above 60, they were already seeing a 60% reduction in hospitalizations. Yeah. So this is amazing, isn't it? Which means that they were not getting stage 3, 4, 5 diseases, the ones where you need to be hospitalized, you need oxygen, you may even need to be ventilated. So they were protecting the capacity of the hospitals, because Israel was going through a very bad third wave with its third lockdown, you know. So with the 2 doses, now they're not only seeing a decrease in admissions and they're relieving the hospital beds, but they're also seeing that the vaccine is preventing the spread of the disease. 2 data coming from Israel. One is from Sheba Medical Center saying that 75% of those who were vaccinated did not spread it. This is amazing. This is called indirect protection. And then there's another group from the Ministry of Health Israel, which showed that 89% of those who were immunized did not transmit the disease. So not only were they protected from being infected, they were also preventing the spread of disease. You know what? This would actually accelerate the movement towards herd immunity.
Yeah. I mean, we're certainly very excited with the news that's coming out from the Middle East, especially from Israel. And we're monitoring what's happening in countries with smaller populations, and even from the UK itself. With the earlier rollout, they're already starting to show really good results from their vaccination exercise. And Kelvin, you as a policymaker, you must be very excited about what's happening and seeing what we possibly can achieve in this upcoming deployment. But having said that, though, there are questions concerning, again, going back to the adverse events issue, and the government has now started to talk about putting a compensation scheme in place just in case that there are some adverse events that occur. Is that something that's reassuring for people to know that there is a compensation just in case there's anything that happens? Go ahead, Kelvin.
Oh, sorry. So I think one of the ways to boost vaccine confidence is that whole indemnity policy, where in case there is adverse reaction, especially those that cause long-term effects to a certain individual, that they can directly link to a person, then the government will compensate. I think many countries in the world actually has that policy. I think Singapore, our neighboring country, also has that policy. So that actually gives certain level of assurance and confidence to it. I think it is also important that we kind of communicate and set the expectations of the public regarding deaths post COVID-19 vaccination. Actually, today I read a very good article written by Dr. Amar and a few of the other doctors, how there will be deaths for especially those with elderly with underlying issues that may die after the vaccination, but not directly linked to the vaccination itself. What I mean about that is, like, for example, today, I am 85 years old with diabetes, hypertension. I got my first jab, and then in 4 days onwards, I passed away. And many people, especially the anti-vaxxers community, would take advantage of that, saying, so there are deaths because he or she was vaccinated. But then we need to look at the whole context of things. And then in that article, if you don't mind, I just read out the data. Basically, the US, for example, reported death rate for people aged 65 years and above in 2019 as 3,970 per 100,000 population. And of course, the most commonest cause of death for 65 years and older in the US was heart diseases, stroke, cancer, chronic lower respiratory, which is very, very similar to what occurs in actually Malaysia. So if we translate that information to our population, that means that for every 100,000 Malaysian aged 65 years and above, close to 4,000 will die each year. And of course, these rates will be higher the older they are, and of course, the more comorbidities that they have. So this is equivalent to 75 deaths per week for every 100,000 persons 65 years and above.
Okay.
So there will be deaths after the vaccine, but then majority of it, if not all, will not be linked to the vaccine, but due to common causes, due to heart attacks, due to complications from the NCDs. And we need to manage the expectations of people so that the anti-vaxxers or people, others that are irresponsible, do not manipulate such information and spread fear-mongering among the people.
So speaking about managing expectations, and I want to pose this question maybe to Dr. Musa or Dr. Helmy here, is that, we know we're trying to figure out who should be prioritized, who should be vaccinated. And just a couple of days ago, there was news that people living with HIV should not be included in the initial rollout for the vaccine. And it caused quite a lot of anxiety amongst the HIV community here in Malaysia. And it's contrary to the advisory that's given by UNAIDS and WHO. People living with HIV can be vaccinated, but the government at the moment, the advisory says it should not. So how do we address some of these concerns by different people who are wanting to get vaccinated? So earlier we talked about problems of people not wanting to get vaccinated and hesitant, but now we have a lot of people who want to be vaccinated and then they're told, oh, I'm sorry, we can't vaccinate you yet. So it's a different kind of problem. How do we go about addressing some of these concerns? Maybe Dr. Musa?
Yeah, great question, Azrul. Yes, there is this large cohort of people who are immunosuppressed. You mentioned those living with HIV/AIDS, yeah? Those who have solid cancers, those who have undergone bone marrow transplant, those who have systemic lupus, those who are intravenous, or those who are on steroids or immunosuppressants. These are the ones whose body defenses are at its lowest. These are the very people who needs protection against COVID, because when they do get COVID, they get category 3, 4, 5. They'll be extremely ill, and many of them would succumb to the disease. So they are eligible for the vaccine. Remember, none of the 4 platforms of COVID vaccines are live. So there is no issue at all about a fulminating COVID disease. No. So they will be protected. Now, but their response will not be as great as you and I, yeah, because their immunity is not that great. So you need to see your oncologist, you need to see your rheumatologist to make sure that your medicines, your HIV is controlled so that you are in the best possible state before they start the vaccine with you.
I think that's great advice, Dr. Musa. I'm glad that you answered it that way, because it gives a reassurance for many of the people who are wanting to get vaccinated and belong to those communities who would want to know the argument and would be able to. I just wanted to go back to a question for Kelvin. We have from somebody who's asking here, there's some talk now about prosecuting people who are spreading misinformation or, anti-vaxxer information. I think the government is quite frustrated with the amount of misinformation, the kind of myths and tahayul, the different kinds of ridiculousness that's coming out on social media especially, and now it's talking about prosecuting them. Is this something that should be done? I mean, we understand the frustrations, but isn't this something that's also a form of censorship or curtailment of human rights even? Go ahead, Kelvin.
My personal stand is punitive or punishment should always be last resort. But we need to look at other avenues, how to educate the public, how to counter such misinformation or direct fake news. However, again, I understand the frustrations. I understand the desire to have a quick punitive, like Dr. Musa mentioned, no mercy. But then there are probably other avenues that we can look at. I mean, if there are medical professionals or healthcare doctors that are spreading such misinformation, we can report to the Malaysian Medical Council, MMC, and they can do the investigation, and their license can be hanged in that case. So I don't see a need to hold them up to court, to throw them in jail for the time being, unless they deliberately cause harm or cause deaths and stuff like that. So again, punitive is last resort. Education has to be the first line.
So,
Azrael, can I just quickly
Dr.
second
Helmy,
that?
yes, go ahead.
I think it should be different depending on who is spreading the fake news. So I think a doctor, for example, has the responsibility of actually going by evidence base and not just giving an opinion. If I were to go out today and say bacterial pneumonia, you don't need antibiotics, just take some honey and you'll be fine. Everyone's not only going to call me crazy, but I will be hauled to court at some point and I'll lose my license. It's different for an individual. So an individual, I feel, has every right to choose whether or not he or she takes the vaccine. But that's very different from a professional going around spreading fake news.
Right. So you have to look at the context as well as the background of the individual, as well as the seriousness, I suppose, of the misinformation that's possibly causing harm. Yeah. But even then, that would still be something to be debated about in terms of what is illegal, what's not, who determines what is correct or not. And certainly when it comes to the developing science, it could be something of a controversy and quite difficult if we were to use laws to try to police this. I wanted to ask Helmy, when it comes to the issue of consent, suddenly for the COVID-19 vaccine, there is a consent form. There is a process in which you have to give consent. So the question from one of our viewers here is why do we need to sign a consent form for COVID-19 vaccine, whereas other vaccines you do not?
The consent for vaccines is applicable to all sorts of vaccines. So even MMR vaccines, influenza vaccines, pneumococcal vaccines, there's going to be there are lots of issues when it comes to safety. And consent is not something new. It is something that is applicable from everything from taking your blood to giving you medication to doing a procedure on you. Now, every hospital and every institution that's going to give out the vaccine will probably have a slightly different consent form. So it depends very much on what's on the consent form. And without really knowing what the final consent form is, it's very difficult to say if that's going to be different from what standard.
Okay, I think that's a fair enough answer to that. And certainly with Dr. Musa being a pediatrician, you must encounter quite a number of parents who are trying to decide whether or not to vaccinate their children when they're born, right? I mean, we're starting to see certain amount of vaccine hesitancy amongst especially educated parents.
Okay, let's put it this way. The hardcore anti-vaccines are very few, right? The government studies give a figure of about 1,500, right? Hardcore anti-vaxxers, they're very few, but they are very, very loud. And they are the ones who spread this misinformation. We have to deal with them appropriately, not punitively, right? Now, but in Malaysia, it's about 10 to 15% who are vaccine hesitant. They are on the pagar, sitting on the fence. These are the ones I take a lot of my time to try and convince them, because at the end of the day, if you are rational, you tell good stories, yeah, you can bring them aboard. And I think just like the 75% of doctors, and which managed to ramp up to 95, I think we can do the same with this lot of people. The 1,500, I think a bit of a gone case lah. I think
this is the hardcore one.
Yeah, like it's virtually impossible.
You say whatever you want, also it's the same.
Not only that, Azrul, there is commercial interest. They are selling alternative medicine. They're selling intravenous mega doses of vitamin C, supplements, minerals. So you are hitting on their bottom line. But the ones on the fence, inshallah, I think you chill out with them over 5-10 minutes. Sure can, especially if you are a doctor, if you are a healthcare provider, because these are the ones who have trusted their lives with you for the past 15 to 20 years. So that's why I take it very severely against doctors and nurses who may not want the vaccine for themselves, but if they make it public, then no mercy.
Oh, okay.
The other thing I would add,
Arjul, is... Yes, go ahead, Dr. Helmy.
Sorry, just ironically, the high standards and questions that some of these people ask of vaccines are not applicable to their own products. You know, so there's no studies for my ubat, mujarab, whatever, but trust my word, it works. So please don't take that vaccine from orang yang, you know, the Illuminati or whatever has, you know, created.
So we're coming towards the last, 10 minutes or so of today's exciting session, I think. And I wanted to give the three of you a chance to share in the most ridiculous thing that you've heard about concerns about the COVID-19 vaccine that perhaps you would want to bring up and address in this forum this evening. Maybe we'll start with Helmy.
The most ridiculous, maybe not the vaccine per se, but the whole 5G being the cause for virus. I think, you know, that goes back to the points being made earlier about there being a hardcore group of people that, you know, it's very difficult to convince. But I think that also links very much into a trust deficit. So a lot of the issues in Europe about 5G and the virus was really about distrust of China. Similarly, there will be some level of distrust with any state, any government, and that unfortunately will spill over to the public health efforts. So I think just as we are pushing forward and trying our best to educate people, there has to be some form of increase or some sort of effort being done to reduce the trust deficit with the state.
So it's really talking about the trust deficit, which manifests itself into these conspiracy theories, the 5G, the agenda Yahudi or Illuminati or some other. You know, one of the most ridiculous thing I heard when the plane landed at KLIA, people got upset seeing this one world, you know, logo on the side of the airplane. Immediately people floating all sorts of conspiracy theories online. But enough with me. I mean, Dr. Musa, a chance for you to share if there's any kind of you know, ridiculous things that we heard concerning COVID-19 vaccines.
To me, nothing that the patient tells me is ridiculous, you know, because I'm there to make sure they've got it right. But of course, quietly in my heart, the one that was really ticklish was when this guy said that Gates was inserting this vaccine to change our DNA so that to make us less religious. So that really got the Ustaz going, you know. They want to make us less Islamic, you know, and make us more secular. So we have to deal with that. So, but generally, no, it's gone at a very fast speed, this warp speed, you know. So I'm sure there are outstanding issues. We can deal with it. We are doctors. We are very patient people. So no matter how ridiculous it is, we are there to you know, to make you understand and hopefully make you make an informed choice.
Thank you, Dr. Musa. That sounds really optimistic. I like the way that you're looking at that. Basically, it is in the best interest of the patient, and that you have an open heart towards listening to what they have concerns about and being able to address that. Dr. Kelvin, one of the most interesting scenes that we saw in the previous Parliament session has got to be your colleague, Member of Parliament, Bung Mokhtar, who said in his debate speech that he is willing to be vaccinated, willing to be put forward to be vaccinated. And some of us were very tickled when we saw it, but some of us also drew heart that he was willing to be vaccinated and wanted to prove it, that, you know, it was safe. And I think that was quite a confidence building, even though we were laughing about it, but it was a good thing. But in your opinion, really, Kelvin, what kind of strangeness have you seen when it comes to the issue of COVID-19 vaccines?
I think one of the reasons why people were celebrating or were happy that Bung Mokhtar mentioned that was because there was this meme that was going around that we should give vaccine to the politicians first. If it works, it's good. If it's bad, let them die and the country is safe. But to be honest, I was there during that debate and I was coming right after him. I was kind of jealous. I don't know if that's the right word. I also wanted to say that I'm willing to take the vaccine. A lot of people actually asked me, because I was an ex-COVID-19 patient. I survived the virus. But people say, do I also need to get the vaccine? And my answer is very simple. I may have antibodies now, but then how long will it last? That is the question that we need to know. And most of the times, we're looking at about 6 months, maybe stretch it to a year. But in that sense, we need a booster, we need the vaccine itself. So actually, there's one question to Dr. Musa, and I hope I can answer it. It's, I'm cured from COVID-19. Do I need to still take the vaccine even if I have antibodies? Yes, you still do, because the antibodies does not stay long. But I think one of the craziest, I agree, Dr. Musa, we shouldn't kind of judge people based on their concerns. Some concerns, you know, a lot of the aunties and uncles, when they spread WhatsApp groups, and even my parents send me a lot of videos and say, is this real? Is this real? Is this real? So we can see both sides. Well, we always complain about the auntie and uncles spreading all this fake news, but these auntie and uncles are also the most time in their hands to spread right information.
Sure.
To educate them as well. So I think one of the funniest that I've heard is, I think it's similar to Dr. Musa, is that it's a whole Jewish conspiracy. Pfizer is trying to earn money. This whole COVID-19 is fake. The amount of deaths in the world is the same yearly. It's the same. It's just normal deaths, but Pfizer is just trying to earn money. But we know, based on science and data, we have seen how this disease is devastating, especially to those with underlying.
So, on a serious note, I just wanted for us to look towards the future, and the future seems to be based on the variants of SARS-CoV-2 that's coming up, where the virus seems to be mutating and producing mutant strains, and the new vaccines that are being rolled out have to be able to respond and to be able to protect against these new variants. So we're really looking at a possibility that, just like the flu shot or the influenza shot, we could possibly even be doing these vaccinations on a yearly basis. And this is something that's a real possibility, right? So there are some people who are, when they hear this, they are feeling a little bit hesitant, and they're asking, what if it doesn't work? You know, what if it doesn't protect me against these new X-Men mutant strains that are coming up? I mean, should we wait, or can we just get vaccinated and then, you know, get vaccinated again later on if there are new vaccines that are being developed? If I could ask that question to Dr. Musa and Dr. Helmy.
Yeah, Azrul, thanks a lot. Excellent. The mutant strains, yeah, the B117 in the UK, and then the B1351 in South Africa, and P1 in Brazil. Now, just look at the efficacy of the vaccines in South Africa. J&J, 57% from a good of about 80%, dropped. Yeah, Novavax, 50%, still okay, but AstraZeneca 10%. So it has been removed from the shelves in South Africa, right? Because of the mutant strains, yeah? And this is why I want to bring up two issues with regards to Malaysia, right? We must prevent these mutant strains, the 3 mutant strains, from entering our borders. That is why, number one, we must make sure the ministers obey the 10-day quarantine period. Can you imagine? They come back from overseas, from Indonesia, right? And you only allow them 3 days, and then after that, they go and see all their constituents. They will be spreading it. It would be, and they are super spreaders. This is by admission, number one. Number two, the social bubble with Indonesia. No way. Indonesia has got 1+ million of cases, and their the positive rate is 28%. They are under testing. So they are incubating the mutant strains. We don't want them in. We need to make sure that they are quarantined before they step into the country. It's very important, because we have not rolled out the vaccines yet. Yeah. You know? And
so we're very vulnerable.
That we've got Pfizer vaccine, and the Pfizer and the Moderna vaccine has been shown to be still very, very effective, even against the mutant strains. But the scientists, God bless the scientists, you know what? They're already thinking ahead. Within 6 weeks, they say they can develop a multivalent vaccine against all these mutant strains. Amazing, isn't it? Because it uses mRNA technology, and mRNA technology is very robust. So within 6 weeks, they can come up with if there is resistance, a multivalent vaccine. Yep.
So I just wanted to, we're coming towards the end here, and I just wanted to emphasize this point that was raised by a person, one of our viewers here, is that, you know, we're very privileged here. We're talking on Zoom, we're talking on the internet, and we're able to talk to each other, we're very privileged and be able to communicate on these information and in the language of science as well, but also to be able to understand each other. I would like to ask for your thoughts in terms of how should we strategize to communicate some of these issues that we've been talking about today to communities which are not as privileged, like the Orang Asli communities, for example, which apparently are quite hesitant towards the introduction of actually any kind of vaccine. But in this particular case, there has been a certain amount of hesitancy that's been indicated, and there needs to be some sort of strategy that looks towards educating rather than prosecuting. So I just want us to spend a little bit of briefly to talk about what kind of strategies that we can contribute towards the government to address some of these concerns by these marginalized or fringe communities. Go ahead, Helmy, start with you first.
I think it goes back to what Dato Musa said earlier on about using different strategies for different groups. So even the language that we use, the medium that we use, visuals versus chat, those are things that can be utilized very differently depending on the audience and the target audience. Now, right now we're into phase 1. It's all healthcare workers and doctors. So the way you would approach those who are hesitant would be very different from, say, phase 3, when we're going down further on the ground. So we do have time, and I think JK, JAV are preparing material where they can actually engage people in different forms, or rather different levels of language in multiple languages. So that will be the way forward. And I do, maybe Kelvin might have a better idea of the challenges, because in Sarawak, there are multiple different levels of engagement. It's not that easy to actually reach people in rural areas. And once again, language and culture is also far greater variety than what we have in Semenanjung.
Over to you, Kelvin.
So I think today itself, I wrote a statement where I believe that the federal government should work closely with the state governments to wrap up this COVID-19 vaccination education, because the state governments will understand the demographics, will understand the local context better. And also, as mentioned by Dr. Helmy and Dr. Musa just now, to translate and to bring this information not just to their local language, but creating videos, creating materials, so something that they can relate to and it's not foreign. So like the Orang Asli community, I was with them in Cameron Highlands before, and they were really hesitant about vaccination because of a bad experiences. Exactly. Yeah. They felt that it caused miscarriages, they felt that it caused infertility and stuff like that. But so we really need to educate them and bring it to their level and their culture. And why I say state governments, because like for example in Sarawak, the Tuai Rumai or the Ketua Kampongs, the Kapitans, the JKKKs or the MPKKs or the leaders of the KRTs, they play a very important role to spread the right messages to these people. And in order to convince this Ketua Rumah, we need to speak their language. And that's why the state governments, actually all society must be roped into this whole awareness and also confidence campaign.
Dr. Musa, the disabled community have almost been unheard in this whole discussion concerning COVID-19, but also in terms now of the vaccination. You must have some interactions with the disabled community. Is there any kind of thoughts or advice that you would want to give when it comes to the inclusion of this community into the vaccination program?
Yeah, well, I work a lot with the marginalized community, including the disabled, the OKUs, but just reminding ourselves that this is not new to the Ministry of Health. In 2013, the Ministry of Health, myself and guys in the Malaysian Pediatric Association, this group called Immunize for Life, right?
Yes.
We in 2013, we were doing roadshows to all the states in Malaysia, including Sabah and Sarawak, right? And in this roadshows, we were addressing the imams, the ustaz, the teachers, the influencers, in the kampung, the jawatan kuasa kampung, So we were speaking to people who make decisions in the kampung, about vaccines, right? And extremely important, I think that we may need to reinvent this, and do it better so that the rural folks, my guys from Imaret, they go into the Orang Asli villages virtually every month, Yeah. So I think we need to use them. And then there's another group of people, the marginalized, the refugees, the migrant workers. Yeah. There are NGOs that do this work. So we need to network with them. This is what Helmy was saying, that there are various platforms that groups that we need to work with, and we will serve the community well. And I also work with lots of this disabled, from the autistic to the cerebral palsies, yeah, to the mentally retarded, to the epileptics. Similarly, there are NGOs that are really good, who build trust with the communities. Okay. I think we need to now get them on board in our awareness campaigns.
I must express my appreciation to you, Dr. Musa, for reminding us that Malaysia has decades of experience in vaccination. And this is something that we've done through our national immunization program, which has been able to vaccinate at least 500,000 infants per year. And this is something that we can leverage upon to also translate towards the adult vaccination programs, which are being done both by government and non-government players. And you just mentioned a few of them just now, which we can utilize. So it's not something new for Malaysia. We're not starting from scratch. Definitely, there's a lot of expertise in this, and that we should be able to definitely lean on the Ministry of Health's expertise as well as those of non-government and government stakeholders. No, we're coming to the end, and I wanted to give you a chance, each of you, to have your piece. And let's start with Dr. Musa. 1 minute. Final words.
Final words. Virtually every parent that walks into my clinic asks me, Dr. Musa, what is your take on the COVID vaccine? So my answer is short and crisp. If it's my time for the vaccine, and I think I'm high risk, man. I'm warga emas, and I'm also a frontliner. I would just roll up my sleeve and and get the shot. And I think it should be in my opinion, the attitude of every healthcare worker, every healthcare professional, every nurse, every consultant, And if you are against the vaccine, then I think you should simmer down, all right? Let others enjoy the information so that they can make a wise decision.
So making the informed decision is a personal decision. Yes. Dr. Helmy.
I think I would second that. You mentioned privilege earlier, and one of the privileges is actually getting the vaccine at this point in time. As much as there are some criticisms about the vaccine arriving late, a lot of effort has gone into getting it here. And there are still over 100 countries across the globe that are not going to receive their vaccines anytime soon. So we should be appreciative of that. And we should continue to engage those who are hesitant because of real doubts, as well as be aware of the fact that things will change. What we know today is different from a year ago, and what we will know in a year's time will be different as well. So the science and the policy has to change with it, based on evidence as opposed to the whims of whoever is in charge of policy making.
But we should also be able to learn from past experiences. For example, I think that the dengue vaccine, for example, was something that has been raised as a cautionary tale. So we should be able to learn from those experiences, right?
And I think also learn from the experiences of other countries that have already rolled out the vaccine. So we talked about Israel. We've even talked about how South Africa has made a U-turn because based on the data they have, the vaccine that they got from AZ was not working against the new variant. So these are what I mean by policy making based on the data that's on the ground. So that I think is important and something that we should cherish and should continue to push for.
Okay, thank you, Dr. Helmy. And we give the last word to the politician in the room, YB Kelvin Yee. Go ahead.
I guess this has been a very informative session, and I believe it has been benefited a lot of people. I think one thing that I hope to challenge each and every one of us is so that we become information frontliners, especially to get right message backed by science and data, of course, out to the community. In an event, each and every one of us get a video or message that spreads wrong information. We should properly educate them and especially share with them the benefits of the vaccine. I think the major message we need to send them is that if not all of us is protected, none of us will be protected. So please get vaccinated and yeah.
Thank you very much to all of you, all three speakers, for being such sports in taking the questions, and none of you seem to have been tired of hearing more of these questions. It must be the 100th question for some of you, having heard so many. I just wanted to say thank you very much for taking the time this evening to be able to engage on these issues and to help us look at the doubts, myths, and firmly put forward the facts concerning the COVID-19 vaccine. And I do hope that this has been a beneficial session for everyone. Certainly for myself, as the head of the Galen Center for Health and Social Policy, we are wanting to see as much as possible a lot of these hesitancy to be dispelled, and certainly with the vaccine to be rolled out successfully in support of the government's initiative. So that's it from me. I will be signing off and handing it back to our colleagues from REFSA. So with that, thank you very much.
Thank you, Azrul. I don't have much to add. I think it was a really informative discussion, very illuminating points that the three speakers have mentioned. It goes back to what I emphasized earlier, that I think when we organized this, we wanted to hear not just the practitioners' knowledge, but also for everyone else to raise their questions and for there to be a chance for those questions to be addressed, flushing out the doubts that we have. So I would also like to thank the viewers for participating in this very informative town hall discussion. I think at the end of the day, we should just be aware that the decisions that we made will not just impact ourselves. It will also have consequences in the ability of our entire society to manage the entire pandemic. So once again, thank you everyone, and apologies for the initial delay. I hope it have been informative and good news for your time in the evening. Thank you. So Azrul, I think we can probably close the session.
Okay,
thank you to the three speakers. Thank you very much.
Thank you so much.
Thank you. Good night.
Thank you. Good night.
Thank you.